Hey everyone, it's Drew here back at FFAS 2018. I'm joined by Dr. Marotta from New York. Welcome. Thanks for joining us.
Thank you so much.
How's the show going so far?
Oh, it's been great. It's been a great experience meeting a lot of interesting people. Just, you know, I spoke this morning. I had a great interaction with people, well received, and
cool.
I'm just enjoying the meeting.
Yeah, you want to talk a little bit about what you presented on?
Sure. I talked about staff development. The title of my talk was called Focus on Who.
Okay.
Who your most important members are your staff, how to empower them, how to engage them, how to make them basically raving fans and practice advocates. So.
Perfect. I love it. I love it. So this is your first year at this conference, right?
Yes.
Tell me a little bit about, so I know it's day one, but comparatively this to the next conference or other shows you've been to, is there anything that stands out with this show that you like?
I love the tracks. I love the simplicity of it. You know, you have 3 tracks. You have a business track. You have a kind of an injectable track. You have a surgical track. And they're all right next to each other, making it very easy to kind of flip back and forth and pique your interest and see what you'd like to learn a little bit more about. And so it's been really good and really
beautiful,
educational.
Awesome. Yeah. Did you get a chance to look at some of the live demonstration stuff, the live surgery?
Live surgery was awesome, yeah.
Awesome.
Saw a little bit of that. It's great to see as a surgeon myself to see just how somebody else does it, what their techniques are, and
of course, you know,
just.
So there's one. I think track 2 here is all kind of non-invasive stuff.
Yeah.
Fillers. That is that. You know, over the last handful of years, obviously the industry's kind of been trending more towards that non-invasive. Is that what your tell me a little bit about your practice?
I do both. I'm I tell people that I'm the specialist, injectable specialist. I'm the facial surgery specialist. What you saw in that track is. It's really not putting people in a box and saying, okay, well, this is a surgery candidate, this is an injectable candidate. It's sometimes combining those modalities for the optimal result for the patient. You know, I sometimes will do a blepharoplasty and combine it with fillers, or we might do a facelift and combine that with, a non-surgical option like laser resurfacing. And it's about getting the patient the best result.
Gotcha.
Using all the tools that we have in our toolbox. And I think when you're a surgeon and you do injectable treatments, I think you're the best suited because you know kind of what you can accomplish with surgery, what you can accomplish with non-surgical means, and how to combine them in an ideal way to get the best results.
Beautiful.
Yeah.
Tell me a little bit about your approach to figuring out on a patient-by-patient basis what you should, because there's so many different approaches to, say, facial rejuvenation. You could do the facelift, you could do the fillers. How do you figure out what is the most effective combination?
I think it's just I do everything you can imagine, from fat grafting to extensive endoscopic facial lifting to deep plane facelifts to periorbital injection of fillers to more advanced techniques with I think having all those tools in your armamentarium, having that ability to kind of choose and tailor it to the anatomy of the individual patient, that's really my job as a physician to know. And it has to do with extremes. You know, the depth of, for example, if somebody comes in complaining of eye bags, how bad are those bags? Is it really deep herniations of fat where, if you put some filler, they're going to look too full, they're going to look kind of maybe corrected, but not that nice natural soft result. I'm going to steer them towards surgeons. Hey, you're not going to be happy with that result.
Okay.
You're going to be. I know you want no downtime, but I can do that with a minimally invasive technique. Get you back into work faster, and that's our job as physicians, to guide the patient into what their best option to because the end result is really what's the most important to the patient. People are realistic about expectations, outcomes, downtime, expense, things like that. We have to work with the patients, but in the end, we want to educate them, tell them what the real deal is, so to speak, so that they know what their final product can be and what they're actually buying.
Beautiful. Yeah. So one of the other things I noticed about this show, which I really liked, is that it seems to be explicit in each one of the tracks where they're talking about complications. I feel like some of the shows we've been to where it's like some of the doctors, they don't want to admit or be vulnerable or say their complications, but talk to me a little bit about how important it is to just the industry or the surgeon when you can talk to somebody about, hey, I have messed up, here's my presentation, don't make these mistakes, being vulnerable, I guess.
Sure. I mean, I think that's what a meeting like this is all about. If we're coming to learn from each other, to learn kind of, hey, some of the things that we're doing, very simple. use of a certain kind of filler in an area may be off-label. There's no studies on it. Physicians, we just start doing it. We're allowed to do that kind of, to bring things into different treatment areas before there are extensive studies on it. And so you might share with you, hey, I did that, but it didn't work out so well. This happened with a certain patient or these sets of patients. And then you share that with other individuals and prevent them and benefit the medical community, because they're not going to repeat those same things
Sure.
on other people.
Sure.
And not only that, learning how to manage, if you did run into that issue of complication in your practice, learning how to manage that effectively. And that's what experts here are about sharing.
Cool.
So,
Great stuff.
yeah.
All right, well, let's switch gears here just a little bit. I want to ask you a couple questions. Maybe give your patients something that they may not already know about you. What were you like in high school?
What was I like in high school? I liked to do everything. I played sports. I was a football player, baseball player. I was, really into school, so academics were important to me. Great social circle. I tried to do everything.
Well-rounded.
Well-rounded. Dabble in a little bit of everything. So.
Awesome.
Yeah.
Do you have, outside of, obviously, you're a plastic surgeon, right?
Yeah, facial plastic
Facial
surgery.
plastic.
Yeah.
Okay. Outside of facial plastic surgery, do you have any other kind of creative, artistic hobbies, or?
I play the guitar.
Okay.
I love to work with my hands. I love technical things. I love to manipulate, work with computers. I love to with technology, future focus kind of
So
guy.
you really are a well-balanced.
Yeah, I have a lot of different interests, and mainly my family. That's my greatest hobby, spending time with them and making sure my kids are
Cool.
are well-rounded people too.
Good.
Yeah.
Okay, last question. What do you love most about doing facial plastic surgery?
I love the patients. I mean, I just, the smile you get on people's faces, the tears when the cast comes off, the people telling them that you changed their life forever, the confidence that comes in, when they walk in with a completely different nose, and this kid who basically couldn't even look anybody in the eye before and is staring me right in the eye and saying, the girls are coming around now, and I have basically a confidence that I just didn't have before in life, and it changes their life forever.
Yeah.
And for us, it's sometimes we lose sight of the focus. It's just, it's a patient, it's a procedure, it's a day for us, it's a routine, but we have to realize that we're impacting people's lives each and every day. And when you have that emotional connection, when you see the patient come in with those, that's what really keeps me going. Yeah.
Great. Cool. Well, thanks, Doctor.
Yeah.
I appreciate it. Thanks for joining
Thanks
us.
so much.
Have a good rest of your meeting.
Thank you.
Yeah.